average guy.
Yeah, normal student.
I was a normal student. I was never a topper because I don't know. From my childhood, I always believed like everybody is doing this. I should also do that. I always question why. Since you're getting transferred, you're going to some other place. Don't tell that you're a student of DPS. He hit on my head and he told, read again. I said,
Okay.
oh, chha, this is podiatry. What is podiatry as? So I took diabetic foot and I did a proper study. That was my first thesis. I never knew that I'll become a diabetic foot surgeon in the future. My granny, she's 91. She's diabetic since 40 years. Even till date, her nail, not even a nail has got spoiled. Because she only has diabetes. She doesn't have other diseases like, so the root cause is blood vessels are getting blocked. There was a video which was going viral in Facebook those days. I saw a video where tilapia fish skin was being applied on the burned fish.
You take the skin out of fish.
And apply it on the wound.
It's not a standard
No,
procedure.
it's not the standard procedure. Nobody does it. In India, nobody has done it in those days.
Okay.
So with their consent, I said, okay, let's do this because you're burned. You have come all the way. You're struggling. You can't afford for a room rent also. So let me do it in this way. For every 1 second, there is a birth. But every 2 seconds, there is a death. But every 30 seconds, there is an amputation
It's happening.
When it comes to India, it is like 1 lakh amputations are happening every year across all the states.
That is alarming.
Alarming, which is increasing at an alarming of 13.5% every year. Coming to my state, Telangana state, on an average, which we have found out through our association, 300 to 500 families are getting affected every month. So almost 10% of the amputations happening in India, Telangana is contributing 10% out of it. So we need to start. So advanced wound healing clinics, we work on 3 aspects.
Okay.
RRR. Restoration, rejuvenation, regeneration.
Okay.
This is my core concept. Nobody knows what has to be done. They just know betadine dressings, ointment application, and that has to come. If you can ask for laparoscopic procedure, you should also ask for VAC therapy. You should also ask for oxygen therapies. So public should understand. The wound is not healing because the oxygen supply is not there, causing neovascularization, new blood vessels are getting formed. So the game is in this way. Change your water, change your gases, you will start healing. That I have incorporated in our AWH clinics. And that's where, without putting a blade, we are trying to do the internal healing first and then externally we see the results.
Okay, good morning, friends. Welcome to the 5th podcast of RM Studios. I believe there are 2 gods. One we don't see and one we see. One we see is doctor. Doctor is the highest regarded profession across the globe. Doctors save lives, touches a lot of lives. Today we have a very, very special doctor. And why I'm saying special is that when I went to his clinic and when I met him in person, I really felt that uh, there's a God, in him. How he has evolved as a doctor, as a surgeon, and now as one of the very different clinics he has set up. And when you go to his clinic, it is called Dr. KVNN Clinic, Advanced Wound Healing. Welcome, sir. Welcome to RM Studios' 5th podcast. And by the way, you're the first doctor I'm going to do a podcast, and it's a very, very special podcast.
Thank
because
you. I'm honored to be here.
And when I met you in person, I was touched on 2 things, sir. One, how you evolved as a doctor, and how you evolved as a clinic, your clinic, especially when I've been to floor by floor. As I saw everything like is being closely monitored by you, and every patient is closely monitored by you. So first, let's get on to the point that how did this doctor, that when did this happen? That I know you spent most of your schooling in North India,
Yes.
and as a typical student, you have spent your +2 in the Vikas Vignan
Yes.
in Guntur. So please give me a backdrop that how did this concept of becoming a doctor?
Since you have asked this, suddenly a memory came in my mind.
Yeah.
I remember I am a student of Delhi Public School, Korba. So my father is into central government. So because he's into central government NTPC, so we keep on transfers keep on happening based on his promotions.
Correct.
So in Korba was the life when I actually saw what is life, friends, everything. Schooling was. I remember one of my teacher. She was an English teacher. I was in my 8th standard.
Oh,
Okay, and she told me, since you're getting transferred, you're going to some other place. Don't tell that you are a student of DPS.
okay.
Hmm.
Yeah, I remember
Don't
you
tell
telling. Yes.
you are a student of DPS, because I was like a average guy.
Yeah, normal student.
I
You
was a
told.
normal student. I was never a topper, because I don't know. From my childhood, I always believed like everybody is doing this. I should also do that. I always question why.
Okay.
Why do I really need to top in the class? Is it necessary?
Okay.
Because even if I get 50%, I know this will sound a little controversial, but this is a fact.
Yeah.
Most of the people think even if you get 50%, you will be promoted to 9th standard. Even if you get 90%, you will be promoted to 9th standard only, not 10th.
Correct. Your
So
ninth standard marks will not make you give you a job
we
or
are
make. Yeah,
passed.
yes.
So, so it is, people call me, they thought I am lazy or whatever, but then I think that what is necessary?
Yeah.
If it was necessary, if everybody is running in that way, do I also need to run in that way?
Yeah.
I always used to question myself.
So you were never in a rat race from
No, I
being
never
as a
wanted
student.
to be.
Yes.
I
Yes.
never wanted to be, and I was very adamant on that.
Correct.
I was very adamant on that.
So you, as a student, always had a clarity in your mind that
Mm.
what you want to become,
Yes.
and you always wanted to be different from others. So that's the first driving point of yours. Second is that a teacher has hurt you, that you or pinched you. I'll not say that hurt.
It's
You never
pinch,
got
yes.
hurt. It pinched you that you should do something different. So it's a first learning you had. So towards a I mean, you made a progress towards making a
Mm.
better student
Yes.
than earlier year. So all the doctors are not gold medalists. All the doctors are not great students. You have average students who have become doctors, who become great doctors.
I always believe that if you keep on competing with others, you're only competing with them. What are you for? You have come here for something.
Yes,
And why are you comparing yourself or competing with others?
correct,
I'll tell you, touchwood, I never in my 15 years of my career till date, I never happened to see how many doctors are surrounding me,
correct.
what kind of cases they're doing, what kind of work they're doing. I never try to find out even.
Um, You are
So because I'm myself involved in my own thing.
absolutely
What Santosh Murthy has done yesterday, how good he is doing today.
correct.
That is my only focus. I never focus what others are doing, because once I start focusing what others are doing, then I try to copy them or try to do better than them, and I forget who I am, what I've come for, what I've meant for.
Correct.
That goes off.
Absolutely. I think that has been there from your schooling days. Now, that kind of a mindset. Mindset is very important for any profession. And
Yes.
you carried that mindset from that you want to be different, you want to do things differently, you want to take challenge, you challenge the
My
adversities.
thought process was like that from the beginning,
Yeah,
that I didn't want to follow the way the
the
protocols are
rules.
set in, the rules,
Yeah.
following rules and all.
So you're a radical doctor.
Kind of, yeah.
Yeah, I get. So, but radical in a positive sense, not in a negative sense. But sir, when I interacted with you, when we had a coffee in your clinic, I've observed one thing is that when you have a clarity that you want to become a doctor, and like any student in Andhra Pradesh and Telangana, you went to a college and did full course.
Yeah.
So this plus one, plus two, once the people they want to become a doctor, they get into a medical college. There's also an option of long term that I didn't get good
Mm.
rank, so I want to do a long term and become a doctor in a good college, paid a government college or whatever. These things have never put you into pressure.
Luckily, it was my mother
Okay,
who forced my dad that my son is not going to waste another year for long term and all these things. We need to get him into paid seat. Now,
okay,
everybody thinks paid seat, you have paid him, so he doesn't have the knowledge, he doesn't have the talent to do this. You cannot judge based on that.
correct, absolutely right. You're absolutely right.
You cannot judge. If that was the thing, then so many success stories are there, which I don't need to name.
Absolutely, it is between affordability and availability.
Exactly.
Yeah,
And so my mother was the one who forced me, like, no, you're not going to waste another 1 year. You're very young. I want you to see, flourish as early as possible.
yeah,
And so that's what the parents can do, max for you.
Absolutely.
And in that case, my mother pressurized my dad, like, no, I'm not going to make him waste another 1 year. We have to.
Correct.
So I got into medical seat through payment only.
You're very candid enough to admit,
Yeah,
yeah,
why
there's
should I
nothing.
always say that only if you earn a seat, then only you are a good doctor?
Yeah,
So, nature decides,
absolutely.
not your marks. It's the nature, it's the Mother Earth who has given you birth. They know why you're born and what you're gonna do next.
Correct.
You can't judge by your marks, you can't judge by comparing yourself with others. I
And
never
anyway,
compare, neither I see other as my competitor.
how are you as a student in MBBS? Which was the professor who has triggered a point that you are a very different Mr. Dr. KVNN and
So, of course, teachers during MBBS, definitely, you're spending such a long time with so you have a different bonding with them.
correct.
So surgery was the department which I always loved to cut open, see everything, and you resuture them, and then you know. So that was very fascinating. So always I used to think whether I'll go for surgery or whether I'll go for emergency medicine,
Okay,
because both are life saving.
absolutely.
Both are life saving. So it was always a choice. Like after MBBS, what I'm gonna do: go for surgery or emergency medicine. I want to take up challenges,
Yeah,
and those which cannot be done should be done.
yeah.
Which
You,
fail,
I,
which others fail to do, I should do. After medical college, I joined in one of the hospitals so that I can, learn the things as a duty doctor and all. So initially, I was in Chennai, one of the corporate hospital, but I was not enjoying it. It was all paperwork. So my father made me join in another hospital, which was tie up to my father's NTPC only. There I met a hospital owner who was
Satish,
Dr. Satish.
Satish. Yes,
Yes,
I remember.
he was a man who made me realize how a doctor should be, what kind of aura a doctor should carry, how
Yes,
should a doctor should walk, how should a doctor should talk to the patients. Though it was there in my mind already since I wanted to become a doctor, but the way I interacted with him, the way he, made me feel
the doctor.
the doctor.
Yes,
Yes. So that I learned there.
from
Hmm.
childhood that you like challenges. In one of our conversations, you also said more than quantity, you like the quality.
Quality.
Yes.
Yes.
So this crisis has made you evolve you as an entrepreneur in you that for the future. So
Mhm.
so Mr. Satish, Dr. Satish has played a pivotal role in you, changing you as a becoming the doctor, and
Yes.
you have learned a lot of things from him. That's what you told me in your conversation. So, when was this?
He was from Sugam Hospitals.
Yeah, and then you moved to Chennai.
Then after that, so when I was working with him, so that was the time I started a small clinic.
Yes,
One pharmacy person has come. He was
I know.
asking me, so I was also excited. Okay, when since I want to become a doctor, if I start a clinic now itself, how it is gonna be?
So what
It
was
was
the age at
challenging.
that time?
22, 23,
Right.
23. Yes.
And you,
So I started a clinic.
wow. Okay.
And I was working in the ICU part because sir understood that I can handle critical situations very well. And so he gave me the ICU doctor post and all. I was doing well and I was understanding patients much better, that how the struggle actually happens. And when you come into the front line, what you're practicing is different. But when you're into the war field, how the soldier feels,
Absolutely.
that's how I was feeling there.
That's a great statement. Yes. Yeah.
So it was like that. We were fighting with the diseases with the same
Correct.
guns.
So you the first step towards in an entrepreneur is that speaking to that pharmacy guy and started your small
Yes,
clinic.
yes, yes.
Yes.
So it was like morning hours I was in the as a duty doctor, I was working there. Evening hours I used to go and sit into the with the pharmacy. I used to go and sit there for 2 hours or something. I used to see OP patients. That time that belt of Chennai where I was having my clinic set up, it was almost like 500 to 1,000 families were not having a doctor surrounding.
Locality.
Look, that was the locality. So I being a new doctor, everybody wants to see who has come, some new doctor has come. They just, and I was also very enthusiastic in start prescribing medicines which I've learned in the
Yeah.
hospital. How I'm dealing there, I'm learning there. Evening I'm coming and implementing it on my patients, and I want to give best of the best med. It's not about the cost because we are very new. We don't know what we are earning, what we are going to get out of it. There was one life changing event which happened. I think it was like 1 or 2 months after I started my clinic. There was a patient who was around 60, 65 years old, and his son wanted to bring his dad to me. The
Okay.
reason was his dad went to the nearby medical college uh, and
And
Porur,
very reputed medical college.
very reputed. It was
Yeah.
in Porur.
Yeah.
So they asked for an amputation. He
Okay.
was diabetic. Diabetic foot amputation was suggested. So they came to know that in their locale some new doctor has come. They didn't want their father's leg to get chopped off. So because his father stays alone and kids stay somewhere else, if
Correct.
the leg gets chopped, and who's gonna take care of
Absolutely.
him? He should be at least in a condition to take care of himself. So they thought, okay, let's give a second try. They came to me. So it was a small clinic, but they came to me and I gave, I was very enthusiastic because I want to become a surgeon, right?
Yes.
So that was the first debridement case which I was doing individually. I've completely taken up a case and doing on my own, doing all the cleaning, debridement, dressing, packing, giving him the best of the best diabetic medicines, painkillers, antibiotics. I was focused on his nutrition also because I understood that nutrition is very important. So what he's eating, what he's drinking, everything. I was taking care of him. That was the first case individually as a surgeon,
Okay.
completely dealing with it. Uh, you know, so how it feels like. You want to give the best,
Yeah. It's a first challenge.
first challenge.
Yes.
And it took almost like 2 to 3 months. After that, the patient went somewhere else to his hometown or something like that. He came back after a month. So every day morning, I mean, the session used to be like 6 to 8 was my clinic hours. 8 o'clock, I'll call him. I'll sit with him, do all the things, and send him by 9.
Okay. This you consistently did.
I was doing because for me, it was not like I want to go home.
Yeah.
My parents are waiting, or I need to go out with my friends. No, I want him to heal.
Yeah.
I made sure. And I didn't have any second thought. I never thought, okay, some big medical college itself
Has
denying,
rejected it. Yes.
rejected it for an amputation. But my thing was, he has come to me, I need to do it. I was not thinking what gonna happen. I was doing it, and it luckily healed.
In this context, when
Mm,
you handle this patient, uh, tell me, sir, as a doctor, there are three things. First is a diagnosis.
mm.
It's what a patient is going through and what is that wound is or what is that disease is the diagnosis.
So then what happened was the patient finally healed.
Wow.
After 3 months, when he came back to me, he came back walking. He came back walking, and the people around, the pharmacist, the patient attender, the son who bought his father, they were like seeing me like a god. They were. Somebody has said that this has to get amputated. It has finally healed, and he's walking back on his feet. The thankfulness which I was seeing in their eyes, that gave me that kick
Yeah,
that yes, this is what I have to do as a doctor. This is the achievement which I want.
absolutely. So that is a statement where amputation is not a
Mm.
solution.
Yes. Then I realized, okay, so even before coming into the profession, these were some of those incidents which triggered me like, okay, I should work on something like this, on wounds. This is the most neglected part. There is a department of orthopedics, there's department of gynecology, department of plastic
Neurology.
surgery, department of dermatology, everything. For every particular part of the body, there is a department, but there is no department of wounds.
Wow.
So
So
since that time, I was enjoying wounded patients. They are the one. Even in the medical college, I used to see all wounded patients. They are the most neglected. Even the professors will tell the assistant professors to do the procedure, and the assistant professor will put it on the interns, like go and do the dressing.
yeah,
They are
correct.
so neglected.
Even today.
Yes,
Okay.
they are the
And
neglected part because nobody wants to touch the smelly. Nobody wants to touch the dirty.
yeah, and they
You as
look
a healer, if you don't touch, who's gonna touch them?
and those patients look out for people who can come and do that and
They wait.
yeah.
I think like suppose tomorrow I am in that situation and people just neglect me. How will I feel? And if somebody touches my shoulder and tell me that I'm there to heal you.
Some of the photographs you have shown me,
Mm,
uh, me as an individual can't even come near to that. I know a doctor has no choice, but you made a choice of healing these wounds. Now,
Frankly speaking, even my mother scolds me. You don't wear a mask. You go to the patient directly. You don't wear gloves. You touch the patient directly. I'm not touching the wound directly. I'm touching the patient. There is a difference. If I'm wearing without gloves, I'm touching the wound. That's okay. I understand. But the patient, already he's having the social stigma that he is boycotted from the society. His wounds are there. He's burnt out. He has a foul smelling wound. He can't walk. He needs to depend on people. So he's already having the depression. And me being a doctor who is going to heal him, make him all right, if I can't even touch him without a gloves, how will he get connected to me? What trust he's gonna have? What faith he's gonna have on me?
very right, very right.
So I make sure I touch my patients, make them feel that I am there for you. If you
Beautiful.
can't make him feel, his brain will not accept you. And the healing starts from the mind,
Not from the wound.
not from the wound, not by your prescriptions. I used to enjoy, love doing periton, opening the abdomen. It's called peritonitis. And the appendix is ruptured or your, duodenum is perforated. So it will be foul smelling, dirty stomach.
Wow.
And I used to love doing it
Yeah,
because cleaning the dirty, making it all good, neat and cleaner, that gives me a great satisfaction.
this is awesome, sir. Because
Yes.
when somebody wants to touch, which is nobody wants to touch, and you love healing people, you as a surgeon want to clean the dirt and make it.
So whenever there is a perforated appendix or any, abdominal perforations, so I used to be there.
Wow.
Definitely you want to touch everything and do clean everything, make it so neat and clean.
Yeah.
So I think
I've seen your cabin also. When I
mm,
see your table also, it is like what you practice, you also implement on your day-to-day life. So
it
that's
is the mindset.
absolutely,
If
yeah.
it is not in the mind, how you're gonna do it on the patient?
So when was the first time the the name podiatry came into your mind, and how?
Yes. So the name podiatry actually started when I was in Chennai, the Sugam hospital, which I was telling you, where I was working as a duty medical officer that time. So there was a podiatric surgeon.
Okay.
It was very new in those days. Nobody knows podiatry. So I was reading it. The medical superintendent was with me, Mr. Gupta, and I was reading the name as pediatric surgeon. He hit on my head
Mm,
and he told, "Read again." I said,
okay.
"Oh, sir, this is podiatric. What is podiatry?" I asked him. That was in 2009.
Oh, so
Hmm.
till that time you don't know what is.
Even now, many doctors don't know what is podiatry. Leave patients, but doctors don't know what is podiatry.
Okay. Podiatry is more
Hmm.
famous in Australia, New Zealand,
Yes.
some part of UK. Even US, what I've read is it's still not got into the.
Even in US, it is still
Yes.
upcoming. Podiatry is not so good.
And in India, you know better than me. So,
Hmm. So what happened after that? The next podiatry, when exactly I came into diabetic foot and all, I wanted to do. We have to submit your
papers.
papers
Yes,
for your final exam before that. So thesis you need to write.
yes, absolutely.
So my HOD, because I was more into wounds, dirtiest and the toughest wounds I wanted to deal with, peritonitis, I want to do some thesis on that, but there were many papers on it. So I went to my HOD. He gave me like a month time. You select your topic and come to me. I searched, and I was like, so many papers are already there on something which I wanted to do. So I left it like I went to my HOD and told, sir, मुझे एक सही topic नहीं मिल रहा है now. You guide me.
Mm.
He gave me diabetic foot.
Diabetic.
He gave me diabetic foot as my thesis topic. This is a small wound, no? This is not a big wound, no? Like abdominal peritonitis and all. It was a small wound, but then since I gave him the option and he gave me the topic selected, so I couldn't deny him. You can't go against your HODs, no? So Dr. KN Singh, my HOD there. So he told me like do it on diabetic foot. Nobody has done. There's very much subject is
Yeah,
not there.
correct.
So I took diabetic foot and I did a proper study. That was my first thesis. I never knew that I'll become a diabetic foot surgeon in the future.
Yeah,
So the podiatry there it started. The patient, my first patient, got healed. And then my professor forced me to take diabetic foot as my thesis. So somewhere I was being pushed naturally into wounds.
Uh, Here I want to, for our audience purposes, I just want you to give me an insight on what is podiatry, what is diabetic foot.
Okay. Podia means foot.
Okay,
So all the foot conditions you are exclusively dealing with, that is podiatry.
podiatry.
Diabetic foot is one of the diseases in podiatry.
Also,
Hmm.
yeah, okay,
It's one of the part of podiatry.
one of the
So
part.
suppose if you have a tree, a banyan tree, if banyan tree is named as wounds,
Yeah,
podiatry is a branch of the banyan tree,
okay, okay,
and one of the stem is a diabetic foot,
okay.
like that.
That is one of the stem of one of the things which is,
Hmm.
and I'll come back to the concept called diabetes, which is uh, the cause in today people are suffering. It's a lifestyle disease, some say, but it's a genetic disease, some people say. It's a disease which has been, a lot of people are suffering. There's a national health mission which says that first thing is diagnosis and preventive. The the mission which has been launched by the government of India is that, like, go to rural areas, go to urban areas, and do a research, get a data where how many people got into diabetes, and what are the repercussions of being diabetes. So there is a lot of initiatives being done by central government, but still a lot of improvement need to be done. But
And I'll tell you one thing:
yes,
initials being taken, everything is done fine, fine. Today, government is not having so much of money, so that they are not focused on
correct. Funds
particular
are not
things.
available.
Funds are not there. But I tell we are not going in the right direction. This is my belief. Why? Because the disease diabetes is because of stress, or rather, any disease in your body, any autoimmune disease in your body. The root cause is stress, right? So, mental health is the one which the government should take initiative on. For have a better, healthy population, the focus should be on mental health. Otherwise, it will be like you got a fever and you're taking a paracetamol,
Yes.
but you're not finding out why the fever has come.
Yes.
You're taking paracetamol. Is it because of COVID? Is it because of malaria, dengue virus?
What
What?
else? Yeah.
We don't know. So you got diabetes, you got a disease, and you're focusing on that. But why you got diabetes? A mental health condition that India needs right now.
Yeah, that is the word depression, the word
Everything.
well-being, the word
Our grandfathers, forefathers, they didn't have so much of stress.
correct.
That's the reason they never had so many diseases.
Yeah,
Now there are new diseases emerging every year.
yes,
New medicines are emerging every year to fight with that disease.
yeah.
It's all because our stress levels are so high.
Is that going to affect the diabetes, the concept of the stress? But diabetes is going to stay
Yes.
in next, I can say next 50 years. That is going to stay.
I'm going to give a controversial statement. I know many people may not like it, but then diabetes को बदनाम किया जा रहा है.
अच्छा,
This is my belief.
ये नया सुन रहा हूँ मैं.
Yes, because diabetes को इतना highlight कर दिए हैं public में. It has become like everything you are suffering with because you have diabetes. Because of that, it is happening.
Correct. That's what you're saying.
Diabetes को बदनाम किया जा रहा है.
But किसको बदनाम करना चाहिए?
Actually, diabetes alone, like cannot cause everything.
Okay.
For example, if you take 100 patients of diabetics, 30 patients will have diabetic foot problems.
Okay.
Out of 30, only 10 are the one who will go for some amputation kind of thing. So only 10%. That is the ratio. So the remaining 70 are good and healthy even though they are diabetic.
Yes.
So if it is because of diabetes, then all that everybody should get a diabetic foot and everybody should
Amputated.
undergo
Yeah,
amputation.
yes.
My granny, she is 91. She is diabetic since 40 years. Even till date, her nail, even not even a nail has got spoiled because she only has diabetes. She doesn't have other diseases like. So the root cause is blood vessels are getting blocked.
Okay.
There is a microcirculation, there is a macrocirculation. So the distal arteries, microcirculations are getting blocked. So basically, diabetic foot is a microvascular disease.
Oh,
The blood vessels are getting blocked, and how the sugars are. What is sugar? Sugar in the body will be like, like how the algae forms in the washrooms.
Yes, yes, yes,
Yes,
yeah.
they're very slippery.
Correct. Floor.
That
Yeah.
is how the sugar is in your blood, in your blood vessels.
Yes.
Okay. And something which is slippery is going to block everything? No, it's not going to happen. So when it is with diabetes, you have cholesterol, vitamin D deficiency, iron deficiency, zinc, B12, all these deficiencies are there in your body.
Correct.
Along with that, if you keep that also aside, no timely food, there is no proper sleep because of stress. Even if you keep that aside, smoking, zarda, tambaku, pan masalas, even that is not there, autoimmune diseases like rheumatoid arthritis, thyroid, vagera, vagera. Without all these things, you keep aside and just focus on diabetes and your uncontrolled sugar levels, increasing your insulins, it's not going to work.
HB1. Yeah.
Hmm. So it has to give a holistic approach. Now, another thing, suppose you have a cancer.
Yes.
Okay. You're taking treatment for cancer, but at the same time, you're continuing your smoking. What is going to happen?
Or die.
Similarly, if your stress levels are not under control, okay,
Right.
your mental health is not good, but you come for treatment of diabetic food,
Increase the insulin
or
also doesn't work.
you keep on going to a diabetologist who is also, now the new concept of diabetes reversal has come up, which is going on well. Even then, you will not achieve the results because mental health is not good.
So, which part of the uh, stage where patient has really need to be worried uh, that they will have a diabetic foot disease or a diabetic foot?
In the foot, if you take as a foot, the podiatry, the foot has multiple components. There are so many bones, tendons attached to the muscles, the ligaments in between the bones. Okay. Then you have your fascia, then you have got fat, then you have skin in between, you have got blood vessels, you have got nerve endings.
Yes.
So everything has a capacity.
Ingrown nail, whatever it is.
Nails, everything.
Yeah,
Everything has a capacity to hold. In the sense, all these things will survive only when there is good blood supply, when there is proper oxygenation happening to the every cell in the body, in the foot. So when all these things are not having a proper blood supply, out of all these things, which one is the first that is going to get affected is your nerves.
absolutely.
So nerves are the most sensitive part, they're the most delicate one, and once the blood supply to the nerves is gone, you develop all the burning sensation and all the tingling sensation, itching, everything is going to happen. And after when it crosses beyond limitations, then you lose your protective sensation. Your protective sensation is lost. That is the first dangerous sign that something is gonna happen very soon.
Suppose let's say you go to a place where two people are walking.
Mm,
One will have a sensation that is very hot.
mm.
One person will not have a sensation of that his foot is not able to feel that there's a heat. He's saying it is fine. That means he has lost senses.
It's not that he's confident
Ah,
or he's accustomed. It's like he lost the sensation.
so that's a danger sign.
That's the first danger sign. If you
Okay,
lost your protective sensation, that's why whenever I go for any CMA programs or give any awareness programs to the public, I tell everyone to
check
every
your
early the morning when you get up and see your face in the mirror, you should also see your feet in the mirror.
absolutely. Test it with water. Test it with cold water, hot
Touch,
water. Yeah,
touch
touch.
your feet.
Yes, feel the sense.
It is our tradition to touch others' feet. Touch your feet.
Yeah, it's a good one. I think how important is the top, the bottom, which is your
Yeah.
foot, is also very
The
important.
importance which we give to our face, we don't give importance to our feet.
Feet is
We walk barefooted or we walk wearing some shoes, even with socks, without socks, smelly shoes, whatever means, that your feet can bear anything.
correct.
You take it for granted.
Yes.
The same smelly gloves you don't wear on your hands, right?
No.
Why you're wearing the smelly socks on your feet?
So it's the most neglected part of the
You
body.
have pain in your feet. You have some your shoes are ill fitted. Still, you wear it. Continue with the same thing because you compromise. You think that your feet can bear anything.
So I'll come back to there are a lot of people who are going just uh, being a diabetic patient. In a diabetic patient, there are two stages of diabetic patient. One is he has a borderline sugar. One
Mm.
has a heavy sugar levels, and their HB1 is not in control. Their triglycerin is not in control. And which part of the I mean, you go to a diabetologist, they'll check the food and they'll give a medicines, and normal most of the people neglect taking medicines regularly. That's part of that's why that diabetes is still is going on, because there is no they're not taking a cure or a preventive steps to reduce their diabetes. So the patient comes to you at the last stage of when their sugar levels are high. Food comes to you when they have neglected everything. So here I want you to touch upon first point you touched upon is the stress level is the reason for diabetes. What is that people should do so that they don't come to you with that food?
So the point is the lack of awareness, sir. We need to create a lot of awareness. 10 years back, there was no much awareness about cardiac diseases. Now everybody is well aware, cautious about their cardiac health. That same caution should come regarding your feet health.
Okay.
So there's a lot of lack of awareness that we have to bring.
So in one of the conversations you I heard you're talking about algae, the slippery in water, and
Yes,
also
yes. Hmm.
how does it I mean related
So,
to
so what exactly is happening? Since I said diabetes is being, you know, diabetes is exactly not the cause for everything for the diabetic foot.
correct.
Diabetes is not the cause for diabetic foot,
It is not the only reason.
not the only reason for diabetic foot.
Correct.
Okay. So usually foot problems are happening because of reduced blood supply.
Okay.
Okay. So when there is a reduced blood supply, like I said, all the parts of the foot. Okay. So there are different parts of the foot, starting from bones. Everything has its own
Nerves.
capacity.
Yes.
Nerves are the one which are the most sensitive. That is the one they lose their protective sensation first rather than getting a wound.
Correct.
That's how it actually happens. So is diabetes doing everything? No.
No, answer is no.
Just like, for example, sugar रखा है kitchen में,
Correct.
ना? It is in its natural form when it is not being touched.
Yes.
But when you pour a drop of water, what happens? The sugar melts
Melts.
and becomes so hard that even if you press with your thumb, no, you
It
will get
will
all the imprints.
it won't break.
Means it has become so hard. Similarly, in our body also, only sugar will not do anything. Along with sugar, when you have all these problems which I mentioned, is there, then all the sugar which is spreaded out will becomes hard and stiff. It will become so hard enough that will block your blood vessels. The blood circulation is getting stopped.
So that's where all
Hmm.
this cardiovascular. And,
Yes, that's where all the vascular and cardiac issues are actually happening.
correct.
The cardiovascular things are happening because there is a blockage. The blockage has happened because there are many things have got deposit, make the root so hard that the blood is not flowing. For example, अगर हम लोग हलाल करते हैं या फिर we do some bali in the temples, no, there's a gush of blood which is flowing.
Absolutely.
That is called blood pressure. So much of pressure is there. You think a simple algae which is spreaded out will be able to block the blood flow,
No.
right? Similarly, but then the vessels have become so hard along with all these other things that it is completely blocking and not allowing the gush of blood to flow through it.
Okay.
That's where the disease starts.
Okay.
That's where the food problems start. Now, why this is all happening everywhere in the body, right? You have got vitamin deficiency, iron, zinc, B12, you have got stress, you have a smoker, alcohol, all these things, whatever I told you, is happening across the body. So all the blood vessels are getting affected. But why only feet you're seeing the symptoms? Because feet is the one which is bearing your body weight.
Yeah.
Your feet is bearing your body weight. And when the feet is having a reduced blood supply, then the feet are getting affected. You still walk on the feet which is already affected with reduced blood supply, that end up into a disease.
Okay. This is a great example.
That's how it happens.
Yes.
So unless we understand that your feet is affected, you lost your protective sensation or you're getting some wounds in your feet, it means the circulation is already less. And you know, to establish a proper diabetic foot which is ready for an amputation, it takes minimum 10 years to happen.
So somebody who's in diabetic stage now and is not taking care of his own needs and or managing it properly, after 10 years he might see you. That's what are
Yes.
you trying to say?
So how the blood supply has to be maintained?
Correct.
You know, Heart is the one which is pumping blood. Okay. So suppose uh, maybe sometimes how to say this. Okay. So this is a building. Okay. The building has a tank of water above it. Water is coming with pressure from the tank. It is coming into your tap.
Correct.
So one day in the kitchen, you open the tap and you see water is not coming. You call your plumber. The plumber comes and sees and finds out that all your pipelines are jammed. Did it happen in one day?
No.
So that's what people tell me, sir. This wound has happened yesterday. This wound I see some 3 days back. Recently, it has happened. It has turned into a gangrene. No, it didn't happen recently. It was happening in the past 10
Mm.
years or even more than that.
Because it's not serviced, it's not maintained, it's not.
Yes. So what is happening? So when the blood flow is not proper from the tank itself, I mean, from the heart, the pumping itself is not good. So the blood reaching to your feet till your toes is also of less pressure. So when less pressure of oxygen is getting delivered, less pressure of blood is getting delivered to the wound side, the wounds never heal. Okay. So there is another thing called second heart.
Second heart.
Second heart.
Okay.
That is your calf muscles. Your calf muscles are your second heart.
Okay. Very interesting.
Yes, because uh, it is the one which is pumping the blood back to your heart.
The reverse.
Blood coming from your heart up to your feet is easy because gravity, there is a pull. Okay. But from the foot, the blood has to go back to the heart. That is a
Yeah.
venous return. And that has to be served with a motor there which has to pump the blood back to the heart.
Back to the heart. Yes.
The function of the motor is what the calf muscles does. So that is the reason they say walk 10,000 steps, walk 1,000 steps or whatever.
Yeah.
So that when you're walking only, the calf muscles is pumping the blood. When you're sitting idle or when you're standing for a long time,
So walking does two things.
your
Yeah.
calf muscles are not active.
Correct.
So that's where the blood circulation is not happening.
So this walking helps you to have the calf muscle getting the blood onto the heart again.
It's not like without calf muscles the blood is not flowing. It is
Yeah.
flowing, but with calf muscles there's a push.
Push. Okay. It's like a motor, you said.
It's like a motor,
Yeah.
yes.
Yeah.
And when this motor is not functioning, don't expect this motor to function better.
Okay. But what are the reasons that motor is not working or
People who sit for long hours, people who stand for long hours,
okay.
that is the main thing. And that doesn't happen in a day. It takes again years. Our body has so much of compensatory mechanisms that the actual disease comes after so much of wear and tear happening.
The damage is getting done from
And so it's not. So suppose you go to a cardiologist. So there is a blood vessels which are blocked in your heart. It didn't happen in a day,
yeah.
but heart attack comes in a second.
Yeah.
For the second to happen, it takes some 10-15 years to process to happen, to be done. Then only that happens.
So after your post graduation and successful stint as a doctor and your first job and your experience with Dr. Satish, and then how does the whole concept of podiatry and you being a surgeon in PG, so this whole podiatry and this diabetes food, managing the wounds, how it started, and to be very honest with you, when I visited your clinic, I've seen your accolades and awards. The whole accolades and award have started somewhere. The root cause can be the trigger point can be one incident or one place where you all started this podiatry.
Nothing was planned, sir.
Okay.
Nothing was planned. I had only my intentions clear that I have to do something which is towards wounds because that is the most neglected part. That was there from the beginning. So how it went on was I finished my general surgery. My thesis was on
Correct.
diabetic foot and everything, which I already told. And then after that, I had to start working as a surgeon. And every surgeon will have that feel that I can do anything from head to foot. I can just open up, close it.
Yes.
So that feel is there. So I came back to Hyderabad and I wanted to work. I want to explore myself now as a surgeon. But then the scenario was different. The scenario was when I'm working in some corporates or something, I had to work under somebody. I have to do paperwork, not touching the patients, not interacting with the patients much. So procedures were, so it was because it was private, no? So
Yes.
it's not easy to directly start doing. Then I realized like, okay, I think I'm not going in the right way.
Okay.
I thought I should have my own thing where I can do my own.
Your clinic.
Yes. So that's how happened to have one of my friend during my college days. He called me and he said like, let's work together and do some establishment in Nalgonda. So that was a small town, which is district, which is away from around 100 kilometers away from Hyderabad. So I thought, let's start. So just casually, I went there. There was some emergency case which I did. I handled it very well, and then slowly, unknowingly, I was into that place which I was
Okay.
not prepared for. But then, destiny took me there because I was with my friend and I was like exploring myself like anything. So I was practicing my surgeries there. So unknowingly, what happened was there was a lady. Okay, so I was doing my general surgery, and during that time only, I went and learned my laparoscopy. I did my endoscopies, and I was like any other surgeon, I was establishing myself in the same way. But there was some dissatisfaction because
Okay.
this is something which everybody is doing. I'm also doing the same thing. I thought I'll do something different, but then here I am doing the same thing what my colleagues are doing, and I was not having that feel once I finished my post graduation because initially it was going in a different way.
Yes.
I was more going towards wounds. So my zeal of dealing with wounded patients was still there. So in Nalgonda, what happened? I was doing with all the kind of dirty wounded patients, and with general surgeries. Along with that, I was doing wounded cases also. Somehow, I was getting more name
Okay.
for wounded patients because that was the most neglected one.
Correct.
So even there was no proper digital media, but start becoming
Yes.
popular.
Absolutely.
That okay, this particular doctor is dealing with
Word of
wounds.
mouth.
Word of mouth
Yeah.
was going on. So slowly, general surgeries was coming down, and more wounded patients I was dealing with.
Okay.
And if I alone do the wounded, it doesn't happen because my staff should also be trained. You should have a separate cabin, separate
Correct.
atmosphere for dealing with it. And I was having that free hand over there. One thing which really pulled me into wounds were two incidents I wanted to share.
Please.
And that has really changed my way of thinking
Okay.
and established me towards wounds. So it was, I think, some Eid, Eid period,
Okay. Ramzan.
Ramzan, Eid. So Jamaat was happening. So there was a person who came all the way from Delhi, he was cooking food in the masjids and all. And he had burns.
Ah,
Okay. He had burns. And
at the time of
at the time of while cooking, he had oil burns. So, they all collected 50 rupees, 100 rupees, 10 rupees, like that. They have collected in the masjid and brought the patient to my center. What happened? That patient was so poor, he couldn't afford with all that minimum amount. And usually, burns means you need to do a collagen applications, and so many things are there. I told them like, see, you can't afford with this amount of money. So that was the time when I happened to see a video where fish skin grafting was being done.
okay.
There was a video which was going viral in Facebook those days. I saw a video where tilapia fish skin was being applied on the burned patient
So you
and all
take
that.
the skin out of fish.
Fish and apply it on the wound.
Okay.
So I just told them like, see, collagen applications and all something you can't afford, but there is another option.
Okay.
And if you give me the consent and if you're ready for
Yeah.
it,
Correct.
then we can do it.
It's not a standard procedure.
It's not the standard procedure. Nobody does it. In India, nobody has done it in those days.
Okay.
So with their consent, I said, okay, let's do this because you're burned, you have come all the way, you're struggling, you can't afford for a room rent also. So let me do it in this way. So he had hand burns, and I just tried. I don't know what is will be the outcome, but with proper consent and everything, we had recorded things. So I documented it and I got it done. I applied fish skin from the butcher fish from the lake.
Wow.
The fish was eaten by the staff and the skin was applied on the patient. We didn't throw away the skin. We applied the skin uh, under aseptic conditions. Skin was applied, and I don't know what is going to happen. 2 days went on. The smell subsided. The patient had no allergic reactions. Nothing was happening. Everything was going on well. We put him on antibiotics, and I was regularly following up. After 5 days, it completely stick to his body. I don't know what is going to happen next. And he said, "Sir, now I'm feeling better.
Mm.
There is no oozing, there is no pain, no fever, nothing. He was doing good, no allergic reactions." And he said, "Sir, now I'll leave to Delhi. I have to go back. I can't stay here for long. I don't know what is going to happen."
Correct.
So then I said, "Okay." And he took my number, my hospital number, and he left to Delhi. There was no contact with him for the next 3 weeks.
3 weeks.
And I was also curious, kya hua hoga uska, what has happened and all that. After 3 weeks, suddenly I got a message in WhatsApp. He shared pictures. The skin which was thick has fallen off, and was a nice pink epithelialization happening on the burnt area.
Wow.
That was like so beautiful. I think even after collagen application, we wouldn't see
That kind of a
that
skin.
kind of result for a burnt patient. And it was a single application. I didn't change it, or I didn't
Okay.
have time already. He just left within 4 or 5 days. Then then what happened, I was so happy. I called him, "How are you feeling?" Then he said, "नहीं sir, हम कर ले रहे हैं, dressing कर ले रहे हैं, सब अच्छा है, everything good." After 3 more weeks, he sent me another picture where it was a absolutely normal skin, like it was never burned before. I'll show those pictures also. I was
Yeah.
so excited to see that. And then after that, the same thing I did in another patient who was a pani puri wala,
Okay.
whose parents were running a pani puri stall, and this guy of 14 years, 15 years happened to fall in
Oh,
a hot water
oil.
thing,
Oil. Yeah.
hot
Okay.
water
Hot
thing.
water. Okay.
Or I think it was boiled milk or something was there at home. Something has happened, and hot water fell, or hot milk fell on him. He was like 40% burns. 40% was burnt. And they know that how the government, what happens in the government setups. They put Savlon and wash him, clean him. The pain, they didn't want him to struggle, but they didn't have money to treat him, take it to a good private hospital and take care. So they were in between. So they came to know about our center. They came to us, and that burn patient also completely non-affordable. So for him also, we have taken consent and said, okay, this is something which we can do. This is a do whatever, but we can't afford. So we did for free of cost for him also again.
Oh.
So we did the burn patient, 40% burns. We took him to the OT. We cleaned him everything under anesthesia. The wound was clean, and then we applied fish skin on it. That time almost 3 fishes were required. So we had a good meal. And the skin which was applied on the wound also, this time I was a little pretty confident that I think
After the first experience.
after the first experience that will come out well. The guy was also very young, 14 years, with 40% burns. He was in ICU. After fish skin application, I think fifth or sixth day, we brought him back to the ward. He was doing good. Slowly, we peeled off all the, because now I was understanding how the
Yeah.
process is
And
going to
how it
happen.
works.
And the wound healed so beautifully. Uh, I think on 25th day or 24th day, I discharged him. Burned patient 40%, and discharged him. See, I don't say this will happen for every patient in the
Correct.
same way. Maybe he was young, maybe his body had good energy.
Also,
Uh,
that's a
ah,
solution which you
mm.
felt is
I
the
was
right
lucky
one.
to get such kind of patients
Okay.
who are healthy enough so that they recover well.
Correct.
So that healed, and he left. After a month, he came back, he showed me again, and then he disappeared. After 3 years, okay, I had a hand fracture, and after my OP, I was sitting in a movie hall watching some movie. So after 3 years, this guy met me in the hall.
The same guy.
The same guy after 3 years. So now he was age 17 or something. And he happened to see me that I was sitting there because I will be in my same uniform. I'll sit in the movie theaters also. I'll just go like that. So there I was sitting, and he came to me, and he was so happily, he was looking at me, and he had tears in his eyes, and he was introducing me to his friends. Sees, this sir has saved me and all that. I took a photograph with him. That boosted up me like anything. Oh man, I could save a life.
So the person who had 40% burns,
Burns.
then
Hmm.
you treated him.
Me being a general surgeon, my interest towards burns was increasing because such kind of cases were coming to me. We did free of cost, and with fish skin, which was something very new. Then I thought, now it's time to publish, and I did some 3, 4 more cases on necrotizing fasciitis, on like that, different diabetic foods and all. I
And that
applied.
person was never in touch after that.
In
That
the three
one.
years, he never was in touch with me. Suddenly, he happened to see me in theater, and he saw like, okay, and we took a picture. He was absolutely normal. The guy, 14 years, who was burnt on bed. I was imagining him. I saw him in that condition, and now he's wearing a nice T-shirt, nice jeans.
You had seen the photograph. Yes. Yes.
Yes. So that was boosted up my confidence. Like anything, like this is the segment which is giving me the real kick. I may do 100 appendix, I may do 200 hernia surgeries,
Surgeon. Yes.
but this
Touching the
connection,
life.
this touch which I had with the patients, wounded patients, that kick will not give me by any other procedure. I thought that's how my interest towards wounds.
Wounds.
So, like I said, wounds is it banyan tree, then burns is also one of the branch of it. So that patient, after that, what happened was, it was more of a calculated risk, I can say, because I've gone through papers. The tilapia fish is something which is coming up as a treatment for burns.
Correct.
It was done somewhere in Europe, not at all popular in India. No much studies were there, but yes, we have seen the results. So I've gone through journals. I've understood that yes, this can be done. Because why I thought, because the patient was struggling, he was suffering. If I don't do, who's gonna do?
It's an. It's a.
Yeah, so my thought was like, I want to save this patient who has come all the way with 50 rupees, 100 rupees in his pocket, which was collected in the masjid, and I need to save this patient. So what else I can do? I cannot say that okay, collagen application you can't afford, so just go ahead and go to some government hospital and get it done.
Painful.
It was painful for me also to reject him just
Yeah.
because financially was not ready. So then I thought like, okay, so I went gone through some research. I've done some research on this, and so many videos I have seen, and then we have got some journals where it was published like, okay, this thing is upcoming.
Papers. Yeah.
So it was like a more of a calculated risk where I thought like, okay, let us implement on him. And I also discussed with my professors and all. They were also not sure, but
Okay.
then I wanted to do it and save him.
Yeah.
It worked.
It is
So
really
then I realized it is not the treatment or the prescription, it is your zeal to save the
conviction.
patient, the
Yeah.
conviction you have towards your patient to do anything but get the result. Then after that, what happened was the results came out so well. I was
Yeah.
so enthusiastic, and I took all those cases. I went to Delhi. I met my sir. He was so much interested. After that, I gave talks in um, King's George Medical College. They invited me. There also, I've given a talk in plastic surgery associations.
I heard you. There are so many plastic surgeons sitting down, and you gave this
Yes. So
presentation.
there, I gave a presentation. Recently, even in London, there was a Burns Association meet. There also, I went to present this paper there. So
So what's this paper all about, sir? After the surgery you have done for that guy, what? How is this
it was like
paper?
case studies that
Okay.
even this way, with zero cost, you can save burns patients.
Okay.
And my sir was so much impressed that he, after that, he sent my results to for International Icon Award.
Okay.
Through my professor only it went. And Princess of France happened to meet me in Bangkok. There was an organization work was going on, and they invited me and gave me International Icon Award for this fish skin grafting. So sitting somewhere in Nalgonda, going to Bangkok to receive an International Icon Award, and then the kind of burns cases I dealt with, doing free of cost without expecting anything, but it gave me something which I never expected or never thought of. That's where the journey of wounds. I was more going into wounds.
So every time you also one of the conversations, and when we met in private and now also, you spoke about universe. Universe throws a lot
So
of opportunities. Hashtag no amputation. How did this big clinic has started in your mind?
my patients were my inspiration, sir. My patients taught me that okay, this is possible.
So these two incidents have made you to start something larger vision.
Hmm.
The
In 2019, the Advanced Wound Healing Clinics,
Yes,
the name,
which is right now in Malakpet.
hmm,
Yeah.
we started in Nalgonda itself. It was a lady, okay,
Okay.
who was a tailor by profession.
Okay.
and she had around 3 kids, and one of and it was her husband who was diabetic foot, and he was around 50 plus. This lady was around 40. There was a 10 years of age gap between them, and she was going to different medical colleges. She was going to all the doctors in Nalgonda and nearby. Somebody who can save his husband's leg from getting amputated. That was the condition. She was almost 7, 8 months. She was going around door to door and finding out. Everybody said, go for an amputation, cannot be saved. That patient happened to know about me and they came to my center.
This is in Nalgonda.
Because they have gone to everybody.
Mm.
So they have a mindset which is set that it is not
It-
going to be done, but because somebody has to, let us give it as a last try.
Try. Okay.
They came to me. So there was a heel wound. The whole calcaneum area was exposed. It was a very dirty wound. And in podiatry, diabetic foot management, it is always said heel never heals.
Oh,
This is the saying, heel never heals. So similarly, everybody was planning for an amputation. But she knows that if her husband is amputated, then who's going to take care of her and her kids and her family? It was a very emotional thing. She came to me, she was talking very recklessly. Can you do it? Somebody told,
you do anything.
You can do it. Can you do anything to this? Um, I was also like, okay, I didn't, her words made me realize that she's not, no,
Stable.
she's not stable and she's, so much she is lost.
Stress and
She was
frustration.
stressed up and frustrated. That's why she's speaking like that. And then I said, okay, just give me a 2 weeks time. If it doesn't happen, then it will not happen. I wanted to heal the food without putting a blade on
Age
it,
on it.
without putting weight on it. Okay. Just by improving the mental condition of the patient, improving the nutritional status of the patient, controlling his sugar levels, and without putting weight, offloading footwear we were given so that the weight doesn't fall much on the leg. So because it is already injured,
Yeah.
you can't put weight on it. Because you're diabetic, you lose your protectors and you start walking on it, and that's how you end up into an amputation. So all these things. Along with that, the most important was gases. So oxygen therapy. It was also very new. That's where I tried oxygen therapy into the patient. Then what happened after 3, 4 weeks, the wound became all right. And she, being a tailor by profession, trusted me so much that the dermal substitute, which cost around 1 lakh, sitting somewhere in Nalgonda 5 years back, when dermal substitute was very, I think 10 or 15 pieces would have been used in Hyderabad.
Okay.
In Hyderabad, she trusted me so much, she allowed me
So try
to
that.
go for it. And the piece cost was around 90,000 or something. It's called Integra dermal substitutes of that big size to cover the whole heel area. The company people were on video call, and they were also checking whether I'm doing it in a proper way or not. My professor was in touch with me. So with everybody's support, I could do it. I applied dermal substitute, put a vac on it, the wound nicely granulated.
Yes, I've seen the photograph.
Yes, the wound granulated, then we put a skin graft over it. The skin was also well taken up. And after 9 months, I'll show you the picture. Till these 9 months, the lady was taking care of 3 kids. So she was telling me I have 4 kids. My husband is also a kid for her. She will take him to the washroom, bring him back, and she was taking care of everything. And now, after 9 months, when he put his first step, along with the footwear and everything, I can't explain it in words. So, when he started walking, the lady was silent, She was not excited. She was not anything. I know. She was silent.
Blank.
Blank. She was blank. Now, he's standing on his feet. He's driving scooty, taking his kids to the school and dropping them back. And all these cases, I'll tell you, I was, So, for the burns, when I went to London and all the publications which I have done, those patients were my inspiration. Same with such kind of diabetic foods which we have handled. These cases, I was called to Delhi to do a presentation because the company saw the results and they himself, they didn't believe that such kind of heel wounds can come out so well.
They were astonished.
They themselves were astonished. The company was themselves proud of themselves that we could, our
We-
product is doing such good. So I was called to Delhi for giving a talk. Now see, I'm sitting somewhere in Nalgonda doing my own private practice as a general surgeon. I was called to Delhi to give a talk about these cases. There were 2, 3 more cases. So they wanted me to do a presentation. I said, okay. Now, when I went to Delhi, that was my first talk I'm giving outside my territory. That too, going to the
Other part.
national capital.
Yes.
And there, the people who were there were all plastic and vascular surgeons who were from
Big hospitals.
AIMS.
Yeah.
They were from, JIPMER,
Big names.
AIMS, big AIMS,
Yeah.
Medanta, and all the big hospitals you name. They all were
Sitting.
sitting in front of me, and I have to do my presentation. Me being a general surgeon from a small town,
Yeah.
it was not easy at all. It was challenging. At the same time, it was lucky to get a chance to do that.
And you are always ready to, from a student of eighth class
Ah,
to now, you always love challenges. You always
yes. So I was
love.
excited. At the same time, I was scared because I don't know how the seniors are going to deal with it. But then the kind of appreciation I got,
Give.
that talk which I gave in 2021 in Delhi and now in 2025, I've given n number of talks. I go to different states, I go to different territories, talk about my cases, talk about my thing to the public as well as doctors, motivating them and learning about podiatry. So that's how the journey actually started. So the nature it was my intentions, and when nature supports you, then this is how the things keep on happening.
Yep, absolutely.
How many cases can I do and I'll to get this satisfaction?
Absolutely. You can't get this satisfaction even if you submit best of the papers also. This is one of the best thing that can happen to any.
This is the real award.
Dr. KVNN, the brand Dr. KVNN, hashtag no amputation, the whole idea of advanced wound healing. Now you move from a place called with lot of experiences healing people. Uh, Now you move to a place called Hyderabad, and
It was not easy.
it is not
It was
easy. Yeah,
not easy at all.
definitely not easy. And you are two roles to be played now.
Mhm.
You are a very successful surgeon. You are a very successful wound healer. Like you touch a lot of lives. The two examples we heard. Now to set up a business, I call it as a business, or set up a clinic or a hospital. Uh, a good doctor need not be a good entrepreneur in
Yeah.
setting up a hospital. A good entrepreneur need not be a good doctor also. So both to go hand in hand. What are the challenges and what are the obstacles, if I am saying, and how were you prepared? Because as a doctor, you learned all your life about medicine, healing, surgery, how to prescribe, and everything. Now you are not an MBA student, so you need to have mathematics, you need to have finance in place,
Accounts.
accounts, everything. So were you equipped or it happened?
Uh, Frankly, during our post graduation, when our education system is like they will teach you how to become a doctor, but not how to establish a hospital, how to become an entrepreneur, and how to run your own thing. It is not there. So we actually don't know. But my zeal of starting this advanced wound healing clinics and doing something for the society, for my state, Telangana state, the zeal had helped me in establishing it. Means you should have the intention right.
Correct. Absolutely.
If you have the right intention, no, things will fall in a line.
Yeah.
That's what I believe. That's what is happening. That's how AWH is established today in Hyderabad. It was not easy for me to working with in partnership with my friend to leave that and come here, but then there were many trigger points. I was like cheated financially.
Yes, yes, you're
So
right.
many things have happened, and because of that I had to move to Hyderabad and do start my own establishment.
So
So when
doctors also get cheated. You're not no
every
exception.
human so when I came to Hyderabad, I was not knowing how to go about it. But then the only backdrop which I had was I was a state president of Indian Podiatry Association Telangana chapter.
Oh, okay,
So that branding is there.
okay,
So it was not like I was completely unknown to Hyderabad.
correct.
People know me even when I was in Nalgonda, and
People,
so that has triggered me, helped me to establish myself in Hyderabad. And I'll definitely thank Dr. APS Suri sir. He is our national president. Indian Podiatry Association is a founding chairperson,
okay,
and he was the one who like motivated me, who guided me, to start this advanced wound here, to start
Wound
this
healing.
advanced wound healing clinics, and also help me like, okay, you're doing good work, and this Indian Podiatry Association you need to establish in a Telangana chapter, as a Telangana chapter also. Along with him, Mr. Anand Suri was also there, who was very helpful. So all these people helped me in establishing myself. So Indian Podiatry Association is something which has definitely make me known
Indeed.
as Dr. KVNN.
To introduce to the world.
Yes,
Yes.
introduced through that. So it was a big platform, and I was lucky to be in it. And my professors, everybody are so supportive that we could do good work. So since last 5 years, 6 years, uh, this chapter is running, and here our intention is like the intention which I had in my core, that
Totally.
to make Telangana an amputation free state, we need to go to the districts. Since I was working in the district, I know what is the conditions there.
Absolutely.
So every district of Telangana, you know, there people need to, bring some awareness to them. There the doctors need to be encouraged to start taking up wound management, podiatry, and to all do all that, you know, with or without the support of government. Then you need to have your own association,
Absolutely.
and you need to where you can gather your people. So Indian Podiatry Association is something which is very unique in the sense you see associations of general surgeons, association of plastic
But
surgeons, vascular surgeons, orthopedicians, diabetologists, physicians. They
neurologist.
have their own associations. This is the association where everybody is there.
Oh,
In our association, you have plastic, vascular, endocrinology, diabetologists, general surgeons, physicians, even physiotherapists. Everybody is in the association. Like-minded people we have selected who join us, and we work together for a common goal, that is making Telangana an amputation-free state.
wow.
So we all work together. We all share our knowledge. We see that a diabetic foot management needs a holistic approach.
Approach.
So everybody has their own role to play. We are not competing with each other. We are complementing each other. We are supporting each other, and we are trying to save a limb from getting amputated.
So it
And
is
when it comes to limb from getting amputated, I'll tell you, every 30 seconds in the world, some or the other part of the world, the 1,000 crores of population, some or the other part of the world, some one limb is getting amputated. Whether it is a toe, whether it is a half of the foot, or below knee or above knee. That is the state now. For every 1 second, there is a birth, but every 2 seconds, there is a death, but every 30 seconds, there is an amputation
it's happening.
happening. And when it comes to India, it is like 1 lakh amputations are happening every year across all the
Alarming. That
states.
is alarming.
Alarming, which is increasing at an alarming rate of 13.5% every year. Coming to my state, Telangana state, on an average, which we have found out through our association, 300 to 500 families are getting affected every month.
God.
So almost 10% of the amputations happening in
Telangana.
in India, Telangana is contributing 10% out of it.
Highest. One of the highest.
One of one of the highest. Tamil
It,
Nadu,
it,
everywhere.
it,
So a lot of work is
Karnataka.
being happening in other states, southern states, where amputation prevention works are happening. And coming to Andhra, Telangana state, it's not so much popular still. It's not so much popular, and because lack of awareness.
And if they go to a doctor, and as you rightly said, every 30 seconds was the one amputation. Now, your hashtag is no amputation.
No amputation.
Now, a lot of people who will be seeing this podcast feels that no amputation, and they reach your clinic. What exactly happens in your clinics?
Okay, so that's a very nice question. So any patient in any condition, let it be grade 1 or grade 5, whatever may be the condition, first we need to give them proper counseling, make them aware what they are suffering from.
Okay,
That is my priority.
so you'll spend time.
I spend around, per consultation, I spend around like 30 to 40 minutes.
So that's huge.
Yes, it has to be, because it's the quality, not the
Not all the
quantity.
quantity. Yeah. It's not the
The
number of
patient,
patients you see.
yeah, it's not number of patient, because this is not appendix hernia hydrocele where patient also knows the condition, doctor also knows the condition, and you don't need to explain them all that. You just give them the treatment option, discuss about the price, and go ahead. But when it comes to this thing where you're struggling, you don't know what is going to happen next. Since you lost your protective sensation, you still walk on it. So they need to first, the fear of losing their limb
Yeah.
has to
be established.
Has to be established, and those are already scared of losing the limb. There, the fear has to come down.
Come down. Yes.
Otherwise, healing never happens when you're scared.
So in your counseling, you will give him that how it is.
Based on the person, every patient needs a different way of counseling for the same subject.
This counseling involves first is awareness of what he is going through.
Ah,
Second, you also talk about healing.
he should know what diabetes is doing in his body. He should know that diabetes is not the only cause for his problems. He should know that if he walk on his feet, which is not having sensation, doesn't show that you are heroic.
Yeah,
It means you are losing your limbs tomorrow or day after tomorrow.
absolutely.
People are adamant, no, मेरे को क्या होगा, चलते जाएंगे, क्या है, मेरे को कुछ नहीं हो रहा. तुम्हें
Yeah.
कुछ पता नहीं चल रहा, पर हो रहा है अंदर. और
अंदर हो
every day, 30 seconds you are standing in the washroom, 80-90 kgs weight on which put on that foot, which is already affected from inside.
Yeah, you're right.
So from that level, they need to be understood that they are at what level, and then what are the treatment options available based on their financial conditions. Because if you search in Google even now, it will show diabetic foot management is sometimes more costly than few of the cancers. It is so expensive. Everybody thinks a normal betadine dressing, an ointment, a roller bandage application, enough will serve the purpose. Yes, it will serve the purpose when it is an acute wound, not a chronic wound.
Yeah, correct.
You had an accident, you had a small injury, you fell down from the bike. Okay, you have some aberration is there. You clean it, put some ointment, do some dressing, it will heal on its own because you have good blood supply.
Yeah.
That is traumatic wounds.
Correct.
But these are those wounds which happened on their own because the blood supply got affected. You got a wound, you lost your protective sensation, and you still walk on it. You just want to put a dressing from outside. Without internal healing, how the external healing is going to happen? So diabetic foot management is internal healing first, then only external applications will come into picture.
According to the government data, which has been published in 2024, Telangana is fourth ranked in diabetes in the country.
Hyderabad is the capital now.
Capital as well as the capital. So 14%, alarmingly, it is increasing every year. If you look at diabetes, it is started with the people, engaged people like 25, 30, 38. Now, all these people will get into the next 10 years, 15 years, they'll get into the age of 50. Now, is the diabetes foot, uh, if not addressed, are they going end up no amputation or that disease need to be addressed? What is that?
I'll tell you, 80% of these cases which are getting amputated on today's date are preventable. 80%. Because in this, early detection is the key. Same like cancers, early detection is the key. Same like cardiac failures, early detection is the key. 80% of these amputations are preventable even when they come a little early. Unless it is complete gangrene,
Yeah.
even then, partial gangrene, only partial amputation can still serve the purpose. There's so many ways of handling it. I'll come to it.
So that there are chances that if not taken care, all these people are getting.
Coming to taking care, the word you have said, taking care, I'll tell you, our body is like a Benz car. Okay, the Benz car needs regular servicing. Then only with proper maintenance it will function great.
Properly.
But if your car is getting repaired frequently, the efficiency is gone, right? So where is the servicing for our body? Our body, there is no servicing. It is working day and night.
Abuse it.
Abused. Our body is getting abused, the right word. So our body also needs servicing.
Absolutely.
So AWH is like a service center for my patients. There are wellness centers, right?
Yeah.
Wellness centers are picking up like anything. New concepts of wellness centers are coming up in market, especially in cities like Hyderabad, Bombay, and all. But there, healthy people are going to become more healthier.
Yeah, correct. You're right.
But at AWH clinics, the same concept, the same wellness is for my patients, which we offer.
There are stages in diabetic foot care when different stages people will come to you in AWH. Can you name me, sir, stage 1, stage 2, stage 3, stage 4, stage 5? Stage 5 stages are there.
Like I said, it takes 10 years for the things to establish at least.
Okay.
Right?
So this has started. So people who are now having a diabetic
From grade 1 to grade 2 to grade 5,
upgrade.
The upgradation happens within months or within days sometimes.
Okay.
Okay. But the root cause is
10 years before.
10 years before it has started. So we need to start. So advanced wound healing clinics, we work on 3 aspects.
Okay.
RRR: restoration, rejuvenation, regeneration.
Okay.
This is my core concept.
Can you elaborate, sir? How does it?
Restoration: first, your body, the deficiencies in your body need to be corrected first so that further damage is stopped.
Okay.
Rejuvenation: without cleaning, there is no healing.
Absolutely.
So your body need to be detoxed, whether colon detox or infrareds, and you sweat out and do all the detox. After detoxing, when you push in 100% oxygen inside your body, you get rejuvenated. When restoration, rejuvenation is happening, why not regeneration? In regeneration phase, there are so many things: stem cells, PRPs, fat graftings, dermal substrate. So many things are there. It's helping regeneration of the tissues which was lost. People are scared to go for skin grafts. They are scared to go for any procedures. But then people should understand that when there is a diabetic foot, the skin is 7 layers. 2 layers of fat, and then your fascias, your muscles and bones. Based on the grading, the deeper it is. And so much of tissue is lost. And you expect everything to heal on its own. So much body has to, your body is already affected.
Correct.
Your body has nutrition deficiencies. Your body has less blood supply.
Yes.
Okay. Your immunity system is down. Your digestive system is down. Your mental health is not good. You expect the wound to heal on its own and you start walking.
Not
So
possible.
without correcting all these things, if you expect the wound to heal, it will never happen. That's how people end up into an amputation. And after amputation, can you assure that after amputation, further amputation will not be required?
No.
That's where RRR comes into the picture. And
So
I realized, yes,
at every
address
stage.
it at every stage.
Yes.
So starting from mental health, I make sure my patients heal from the mind. I give them a very simple example, which I generally tell to all my patients. Suppose you're depressed, you're dull, okay, you're frustrated, you're stressed up with something, and I give a nice biryani in front of you. Will you be able to eat it?
No, no mindset.
Absolutely no, right? So what exactly is happening? When you're stressed, the stress hormones are releasing, and your blood vessels are also under stress. When your blood vessels are under stress, the blood supply to your stomach is also reduced.
Correct.
So stomach acid is not getting produced. You're not feeling hungry. You don't eat. Suppose you're healthy, happy. You're happy. Then happy hormones release in your mind. Your blood vessels are also relaxed. Good blood supply goes to your stomach. More acid is produced. You feel hungry. You eat. Same body, same person. That time he's not eating. This time he's eating 2 biryanis.
Yeah.
Same thing is applied to your feet. Same thing is applied to your wounds. Your wounds will heal when there is good blood supply. And when you're stressed and depressed, you expect the wound to heal on its own. You're waiting, you're stressed, अरे कब ठीक होगा, मैं कब चल पाऊंगा, and you're stressed up about it.
So it's a mental battle you have to win.
Counseling, make sure your patients, they feel good when they come to your center.
What applies to in cancer? Cancer is also, people
Yeah.
say that 50% is winning the battle over the mind. That
You should train your patients to win the battle on their own.
So you face any when a person walks into your clinic with a no hope, with gone there, and when the clients of I say clients or patients visit your AWH, this is somewhere somebody has told him that there is a place in Malakpet, there is a God, there is a person, KVNN, who has a lot of experience, who has touched a lot of lives in Nalgonda. You go there, try it out, and when they entered first day to your clinic without any hope, you can see in CCTV they'll be sitting in the outside with a lot of dull face and their family suffered. So
Yeah.
how do you when they come in, what is the stage you start? And can you can give
My
one examples
patients,
also? Yes.
my patients, actually, we don't do much of digital marketing. No, I don't have
I
a
have not
PR
seen.
team and all. My patients are my PR. My patients are my marketing. It's
Word
a
of
word of mouth I believe in. They trust, and that word of mouth
carry.
they carries, and the patients come to me. The moment my patients step in, they see other patients and start interacting with them. There only they gains the confidence. Now, me being an entrepreneur, I know I'm not so much into how to run a hospital, how to have a trained staff, how to receive them, and all these things. Neither I am trained, neither my staff will be trained on it. So my focus is not that. My focus is, see, you have come here for a problem. You have come here for a solution. You didn't come here to, enjoy the surroundings, the amenities, and, I'm not, you didn't come here for a
The
restaurant.
food restaurant. Yeah.
Yeah, you didn't come here to enjoy the ambience.
Correct.
But yes, I do focus, I make sure that my patients have that. But that should not be the priority.
Absolutely.
You have come here for a purpose to save your limb from getting amputated, not to sit and relax in a chair
Yeah.
with a nice AC and somebody is coming to receive you well. Those things should not be the expectations. Your thing is whether the treatment approach is good or not, whether the doctor is able to satisfy you or not, whether the doctor is able to heal you or not.
Identify, diagnose.
Yeah.
Yes. So, what's a patient's mindset you generally observe that people need to change?
Change in the mindset, because you have come here for some purpose. That should be the priority. And most of the patients also have another issue is with the finances. Like I said, diabetic foot management, it's quite expensive. It's not so easy. To chopping it off, it takes 2 minutes. But to save the same limb and make him walk again on the same feet, bearing
time.
his 80 kgs or 100 kgs of weight, it will take 2 to 3 months for the doctor to struggle.
Correct.
So I tell all my patients only one good example I give them. Like, when you come with your feet, okay, which is not having a blood supply, which doesn't have oxygen supply, and you're going to lose your limb from, undergoing for an amputation, that is the condition you come to me. Okay. It is like a barren land for me. So in a
Yeah.
barren land, what do you do? As a farmer, to cultivate crop, what I need to? I need to plow it nicely.
Absolutely.
I need to add fertilizers. I need to add water into it, make it a proper fertile land,
Fertile land. Yeah.
and then bow those seeds.
Absolutely.
And then take care of the seeds to become germinate
Grow
into
plants and
crops, plants, and trees.
you're right. Absolutely.
That's what I do to my patients. I work like a farmer.
You're a farmer,
Yes, medical farmer.
medical farmer.
So
Can
make
you
them understand that this is how you need to go through the whole process. If you step into my clinic, you see time and patience to heal is the tagline I have put.
I've seen that? Yes.
Healing takes time and you should have patience.
Hmm.
If you don't have patience, don't expect to heal.
It's not a headache that you put a
Ah,
cross pain
it
relief
is
and it
not a
goes off.
paracetamol tablet to
Yeah.
heal you.
You have cultivated for so many years and it takes time to.
And only those patients heal who think that the clinic is a temple. They have come for healing. They will only heal and they will never recur also.
Hmm.
It is your patient mindset.
That makes a lot of difference.
It is the mindset of the patient which is poor. The patient is not poor. You have a cardiac issue. You need to go for a bypass surgery. If you say you don't have money, you don't want to do a procedure, what will happen? You lose your life.
Collapse. Yeah.
But when you lose a foot and your foot is getting amputated, even though you are alive,
It is as good as dead.
it is as good as dead, because you can't do anything in your life. You can't walk around. The day you're born till the death, it is your feet which is carrying your body all the way. This case was also really touching. Means I'm
Absolutely.
happy that today I have established something which has touched so many lives.
Correct.
So AWH is giving me a lot of satisfaction that I could do this.
Yeah.
So it was very tough for me initially to start AWH, but during the process of journey, it kept inspiring me was my patients and their results, their
No doubt.
outcome,
No doubt about it.
and that kept moving me, even though all the hurdles I'm facing, because I'm not an entrepreneur as such.
Yes.
I've never come with a business mind. I want to do something. To do this, I need a clinic. I do this, I need this kind of equipments. I need such kind of establishment. That was only my thought process. I was never prepared, like, I should have something like this. I need to take care in this way. All those things, like an entrepreneur, I never had thought process. Even now, I don't have, and that's where I'm struggling also. But this, we keep learning. We keep learning with things. Just like how that fish skin I have applied on the patient to get the best outcome of the patient. Similarly, this establishing clinic is also like that. I never take it as a stress. I never take it like I'm struggling to run a clinic or something like that, because my intention is not for business. My intention is to heal the patient,
Absolutely.
and I need some space for doing it. So that's way only I'm going. And so whatever uh, mm, hiccups I'm getting, whatever difficulties I'm getting, I'm bearing with it.
Yeah.
Hmm.
So the second one was also very
Another
interesting.
lady,
Seeing.
I'll
Yes.
tell you, this was also very heart touching. The girl was unmarried girl who's taking care of his father. The father is a smoker. He's diabetic. He's adamant. Everything, all the complaints she tells about his dad, but she loves him. Girls love their father.
Absolutely.
So he happened to have a diabetic foot. He was somewhere in Andhra, and one of their close relatives were also doctors who said to go for an amputation. It was so easy to say to get amputated. It's very easy to say, chop it off. But what the patient goes through, what the family goes through, that the doctor should realize before putting a blade and cutting it off. So this man said only one thing, beta, I cannot walk right now. I can't even perform your marriage after this because I'm amputated, I'm bedridden. How I'm gonna take care? I'm feeling guilty. So maybe one or the other day I may commit a suicide after if I get amputated.
Yes.
You take care of yourself. मतलब వీడ్కోలు we
Better now.
call in Telugu వీడ్కోలు means the last final bye he was telling to his daughter.
It's all over.
It's all over now. I can't. The girl who is unmarried, for him the hero is only his father, and the hero himself is giving up. What will be going on in his girl's mind?
Young girl, not married.
Young girl, not married, looking for a job. The struggle they go through. Can't imagine. She never lost hopes. She took his dad, Andhra, Telangana, all the doctors, everywhere. Everybody was trying their best. See, no doctor will
Yeah,
just like
give up. Yeah,
give up. No, they tried their best, but then it took almost 1 year or 1 year, 2 months,
to reach you.
almost. And finally, everybody gave up, and they
And
said
they
now
reached
it's time for amputation. Nothing can be done. She spent lakhs. She spent lakhs, but there was no result. She came to me finally through somebody. They came to know how they came to know. Somebody, some unknown person, in one of the hospital receptions, was passing by, seeing the daughter sitting dull with his father leg in her lap. Her father leg was in the lap because he cannot put it down. Her father's leg was in her lap. She was dull sitting there in some of the hospital reception. Somebody, while passing through, saw that, went to the girl, told her that there is a place. This is the doctor name. Go
Go.
there. Maybe something. And he left. She doesn't know
He's a
him.
messenger.
Like, it happens. So these are all stories when patients tell me, no, I feel so moved.
Yeah, it is.
So that's how she came to know about me. She came all the way. She was crying, sitting in front of me. She was more than explaining the condition. She was crying. She was letting out all her tears.
Yeah.
I also didn't assure her anything because it was a severe osteomyelitis case. All the 5 toes were already lost. The skin is exposed. The heel is exposed, and it was a very bad condition. And spending money on it was also little. I was also a little,
Capital.
whether should I go ahead or not, because she has
Pick up the
already
case or
spent a
not.
lot.
Yeah,
Yeah, she has spent a lot. But then she said, "Sir, this is the last hope. Do whatever you want." I said, "Okay." I tried all the latest advanced things possible on earth, which was at my center. I could get it. We could do it. But then initially, the first 1.5 month, I was also not getting results. Then I understood the healing is not happening because the man is not prepared.
Mm.
He was not
He was in
having
the
hope.
give up mode only.
Daughter was okay, but since 1 year of struggle he has gone through, his system is down. Gradually,
He,
gradually.
he
When
roamed 1 year to hospitals with
when
daughters.
he got some hope, okay, some improvement, or some ray of hope, he started trusting me. He started believing me that this is a different process which I'm going through. And almost a 1.5 month later on, I started seeing the results because he was now in connect with me.
Okay.
The bonding has happened with me and the patient. Now he is getting a hope that, okay, I think my leg can be saved. I think I can stand up. I think I can walk back. He started believing it, and the changes started happening.
It's all. Yeah.
I did everything, but even I was not getting that result because. But then the moment he started changing, I saw the results. So one
There's
and
a
a half, two
point, sir.
months.
Here, there is an equal responsibility of a
Hmm.
patient to be in that state of mind that it can be healed and to have trust on you and faith on you.
If you see across India, there are wound care centers.
Correct.
There is no word called wound healing center. And when I use the word healing, I assure that it heals. So that's the reason I specifically say the healing starts from the mind.
Beautiful.
The patient started improving. There was a lot of change. I don't say the other doctors didn't do their efforts. Everybody did.
Yes.
But then the patient was in not connect with me.
Connected. Yes.
When he believed that yes, this is gonna happen, this man can save me, the wound healed.
There's a difference,
The
right,
wound
sir?
healed,
Yeah.
the wound healed, and now he is walking back on his feet. Of course, with a stretcher, with the help of a stretcher, which was almost supposed to get amputated, healed, and then we fixed it with a orthopedic friend. We fixed it with the external fixator. Now we removed the external fixator
I've
also.
seen that, yes.
Yes, now he is walking back on his feet. We gave him nice offloading footwear, which is very much customized. 2 3 times we had to change it, but we made sure it happens. Now his daughter is getting married,
Wow, sir.
and he is taking care of his daughter.
Super, sir.
The reason which he told that I may not be able to perform your marriage because now I am amputated. Now he's standing on his feet and making his daughter get married. So that then I really I don't know how to say, but the my purpose of advanced wound healing clinics was served when I see such
It
kind of
is, it is
cases.
true. I'm sure that many more cases will come to you and you'll start talking about healing starts from mind.
Mm.
And may God give you a lot of strength to, you're already powerful in terms of very strong emotionally, and your intent of healing people and touching a lot of lives, I think is good, sir. Yeah. Now that you've established AWH and from past 5 years, you've touched a lot of lives. You're still uh, touching a lot of lives, and you as a doctor got recognized by international forums. You got an award. You also submitted a lot of papers, and now that I heard that you're getting collaborated with American company, uh, please give your insights on how you are looking at one, a podiatry as a subject. Second, Dr. KVNN as a no amputation hashtag, and advanced wound healing as a clinic. How do you want to take it?
Requirement, sir. The requirement is huge. Alone KVNN cannot handle everything. It's not one man's job also. That's the reason this association, we are spreading the knowledge through the association, Indian Podiatry Association. Dr. APS Suri sir, whose dream
Yes.
of starting this association, and many people like us are getting benefited out of it. And so once we have this collaborations, now what happens? People will be more encouraged with the memberships and all, more encouraged to take up podiatry. They can come to my center, they can go to Delhi, and we can share the knowledge because it's not one man's job,
Yeah,
and so many hundreds of patients are getting amputated. We
absolutely.
need to save their lives. So through these associations, we are training the doctors, sharing the knowledge. They can become members. And coming to AWH clinics, one of its kind, which we have started.
Yes.
I am interested to expand this so that every the no amputation tag, making Telangana an amputation free state concept will only be achieved when we reach the masses,
Rural India,
rural
80%. Yes.
areas.
Yes.
80%, 70%, 80% of India is in the rural.
Absolutely.
And unless you touch that till that roots, like how in diabetic foot we heals from the roots for the patient. Similarly, you should touch the roots of the society. From there, if you start, so preventive podiatry, advanced wound healing clinics I have divided into three segments: Sri Krishna Foot Clinic, preventive podiatry, and Punarnava.
Punata.
Where Punarnava is all about rejuvenation and regeneration process. And preventive podiatry is the one which I'm more looking forward to expand into the districts,
Okay.
reach the public where they can
You have
early
centers.
assess.
You have centers. Yeah.
Yeah, where they can early assess. I've already started 2 3 centers in the like Nalgonda, Chittiala, and all the small areas where you actually don't need a professional doctor to sit there and look after the patients. Where general assessments, foot analysis, gait analysis, or customized footwear can be given to them. Like I said, 80% of the amputations are preventable.
Yeah.
So early detection, giving them medicines, taking care of the changing their diet plan, changing their lifestyles, all these things, the preventive podiatry concept can go into the districts and it can change lives. So I also trying to collaborate with the governments Recently met health minister and all, explained the concept of podiatry, our association,
So the
everything.
collaboration between private and government also need to be developed,
It's
and
time taking process, you know that.
it is.
But the maximum which I can do from my end, collaborating with doctors, establishing these centers in the peripheries,
Are you planning any awareness programs on this, sir?
we keep on doing.
Okay,
Every month we have awareness programs through the association.
great, sir.
Every month we have CME programs which we conduct. Any new product which is coming into the market, with a group of doctors, we all meet and we discuss and we try to incorporate in our practice. So these things are anyways happening. And through my AWH clinics also, we went to churches, we went to temples
Wow.
where there is a good gathering, and we spread this. We try to do a foot scanning for them and tell them that your foot is at risk. Find out, give them early uh, identification and make them aware what about their foot conditions, because one limb you are saving means one family you are saving. So a lot of works are going on. So we want to reach with AWH clinics, with the help of our association. We want to go reach into the roots, and it's not a one-day process. It's going to take years together, because the cases are not limited. They are increasing. Like I said, 13.5% annually.
Yes, it is.
So the number of uh, exclusive podiatry centers, how many they come also, still the requirement is high. We can never reach the requirement.
Absolutely. Shortage of nurses, then
Shortages. And nurses, of course, since you said nurses, the training for nurses to touch these wounded patients
is not easy.
is not easy. You are in an ICU, you are in a ward. Okay, there the management is different. Here, when you deal with the wounded patients, the management is different. The care you give to those patients is different from the care you give to these patients. So, training these nurses to take up the case and do is also a big task. Training the doctors and influencing them to start treating diabetic foot cases is also a big task. But then somebody has to start somewhere.
And your fraternity of doctors, how helpful and how aware they are aware of that, okay, this is the guy who has come for amputation, so let me refer to this AWH, or let me send them to
So, it
KVNN.
is like when to refer. You should learn the right time to refer. Simple basic cases anybody can handle. So, we are training everybody in the same way. But we make sure they learn when to refer
Okay.
to a specialist, to a plastic surgeon, a vascular surgeon, a podiatric surgeons like me. When to refer. That if it comes properly. Now, see, the awareness should be coming into the public in such a way. For example, a patient who is having an appendix. So, he will go and ask the doctor whether you are going to do an open procedure or you are going to do a laparoscopic procedure. Patient is having so much awareness. When you go to a cardiologist, the patient will ask whether you're going to put a stent or you're going to do a bypass surgery. They know. Like you go to a cardiologist, they'll do an angiogram, and through an angiogram, they find out 50% blood vessels are blocked. Then they'll give you medications. 80% it is blocked, they'll plan for a stenting. 100% it is planned, they'll plan for a bypass procedure. Now, when it comes to food, nobody knows what has to be done. They just know betadine dressings, ointment application, and make them walk again on the feet.
That's it.
Some patients even say the more we walk, the more the blood circulation is improved.
Correct.
There is a supply demand ratio. The
Yes.
supply is less. You're increasing the demand. So you fail. So this awareness when comes to the public, I want this awareness to come to the public that they come to the doctor and ask, are you giving what kind of offloading footwear to me? Do you have WAC therapies? Do you do debridements? So public awareness, the more public is getting aware, the doctor will also become more cautious, and that's how the knowledge is spread, and people start taking up cases. That has to come. If you can ask for laparoscopic procedure, you should also ask for WAC therapy. You should also ask for oxygen therapies. So public should understand the wound is not healing because the oxygen supply is not there.
I know it's a continuous subject. We require a day to.
Yeah.
I mean, it's such an in-depth because it's a root cause. Diabetes is the root cause. But what I take
One more
away,
point I want to
yeah,
tell is
please.
oxygen is life. Our body is made of billions of cells, and every cell is surviving because of the oxygen which is going to the cell, that is calling cellular metabolism to run. That's how energy is produced. So oxygen is the key. Now, there are thousands of crores of population on this earth, 87 lakhs of species on this earth. Everything is surviving on oxygen, right? So oxygen is the essence. So every cell, oxygen should be there for the cell to survive. Now, the oxygen has to go to every cell at a certain amount of pressure, like blood pressure, 100, 110 millimeters of mercury, 110 by 70. The oxygen has to be delivered to the cell at 50 to 60 millimeters of mercury pressure. Okay, now this is going to make another statement, I'll tell you. So, 60 to 70 or 50 to 60 millimeters of mercury pressure, oxygen is going to the cell. The cell is healthy. When the pressure fall down to 20 millimeters of mercury, then anaerobic atmosphere is happening. There you start developing infections.
Oh,
When the oxygen concentration, the pressure of oxygen is going to 0 to 5, okay, it is causing cell death.
okay.
Okay. Now, 0 to 5 is causing cell death, and when it is 10 to 15, it will cause cancers. So, it is the oxygen supply which is causing your gangrene, which is causing your infections or even cancers. So, the oxygen supply is the key. Okay. So, a patient who is having wounds, who is not healing, or repeatedly the wounds are happening, they're going taking antibiotics, they're taking painkillers, they're doing all the dressings, the wound is healed, again it is happening, again it is happening. Why? Because the bacteria is staying in that particular area. Now we are in this cabin,
Yeah.
comfortably, because you have a nice
Obviously,
AC, you have good
nice tea
moisture
served.
control. Yes. So similarly, the bacteria is also having a nice tea served there.
Yes.
The local environment is, for the bacteria to grow,
Yeah.
is acidic environment, is anaerobic environment. So when there is a lot of acidic environment and anaerobic environment, the bacteria is comfortably staying there making kids.
You're right.
Yeah. So unless you change the environment, unless you reduce the acid levels, reduce the inflammation, just by putting antibiotics, the results will not happen. That's the reason the wounds become chronic, and chronic never heals. They develop a biofilm over it. Now coming to the biofilm. Now what biofilm is? You do all the dressings, you do everything, but there is no improvement in the wound. At the same time, it is not deteriorating also, but you don't see any results. That's how chronic wounds develop. So what is the major cause of chronic wound to develop is the biofilm which is formed on it. What is biofilm? Biofilm is like a umbrella. Yeah, like there is a lot of rain. You open an umbrella and walk. Similarly, the bacteria is also live, no?
Yes.
It knows that there's a lot of antibiotics, betadine, everything is pushed on it. It means scrubbed. So it creates an umbrella over itself,
Yes.
which is a biofilm. Once that is created, then what is happening? It is not dying, it is undercover. So we need to again remove the biofilm. So chronic wound management goes in that way. At the end, the point is you need to reduce the infection not by giving antibiotics, it is by changing the local atmosphere, by improving the oxygenation.
It is
Yes.
what is the best way to address that, sir?
Reducing inflammation, improving oxygenation is the key. Rather than putting antibiotics, spoiling your stomach, your GI system is getting affected.
What is the best way to address that, sir? So oxygenization. What is the best way?
Hyperbaric oxygen therapies,
Okay.
ozone therapies,
Oh,
tropical oxygen therapies, warm oxygen therapies.
oh,
Now even CO2 is also used
oh,
as a stimulant. When there's a lot of CO2 in the chamber, the brain gets a stimulus that it has to make release more blood vessels into the site to reduce the CO2 levels. Like that, many concepts have come up. The idea is no amputation. To reach that no amputation level, we need to heal from within. That's where oxygen therapies, ozones, all these gases come into picture. To reduce the inflammation, the best inflammatory is hydrogen,
yeah,
hydrogen water, hydrogen gases. We inhale hydrogen, we give hydrogen water.
water. Yes.
Yes, that reduces inflammation. So unless the inflammation doesn't come down, you don't see the changes.
And
So
inflammation is also one of the root causes why people are not reducing weights also sometimes.
inflammation is the root cause for everything.
Yes.
Head to foot, you name a disease, there is background, there's an inflammation.
Yeah.
And inflammation is increases because of stress again.
Yeah. You're right, sir. Absolutely bang on.
Now, when we have started about water, I make sure all my patients first change their water. 70% of your body is water. If the 70% water is clean, 70% diseases are controlled. The water which our ancestors, forefathers used to drink was pure water.
River,
Yamuna
well,
Nadi water was the purest form of water.
absolutely.
That water, when it is traveling through all the
Dirt and
drainages, guts, everything coming to the municipality, there they're adding chemicals. That water is coming into your overhead tanks.
chlorine,
Just with a little RO, okay, you're removing some hard metals out of it,
metals, yes,
but you're drinking that unhealthy, lifeless water with lot of acids in it, and you think RO is doing everything.
alkaline and
Hmm.
chemical.
If I think most of the the foot leg problems, the bones are getting affected because of mineral deficiencies. So,
So
so the water has to be so pure. So there are so many types of water. Now, alkaline water is there. You have got hydrogen water. You have got ozone water. You have got Jiva yummy water, which is bringing life to your water. So many ways. So these is the we
so
need to stress on. Change your water, change your life. And
educate,
the treatment of DFU management is more on medical gases. Carbon dioxide is there, which will be stimulating. Hydrogen is there, which will be reducing inflammation. All the hard, tough tissues will become soft. After that, you give oxygen therapies so that the soft tissues, oxygen is going in and causing neovascularization. New blood vessels are getting formed. So the game is in this way. Change your water, change your gases, you will start healing. That I have incorporated in our AWH clinics, and that's where without putting a blade, we are trying to do the internal healing first, and then externally we see the results.
end of the day, there's a quote that you are what you drink and what you eat.
Yes, absolutely, absolutely.
Yeah, absolutely. It's a pleasure talking to you, doctor. I think the whole objective of you establishing advanced wound healing hashtag no amputation will be most successful mission in Telangana. We want to make a Telangana state with a no amputation this thing, and you
So we are trying to spread up
correct.
advanced wound healing clinics, make sure that it reaches to the masses, go into the districts, different parts, with the help of our colleague doctors. So many entrepreneurs have also tried
Yeah,
to
try to
approach,
sure,
and with like-minded people, once they get attached, maybe because it's not a one man's job, to make Telangana, it's a big thing. And the more like-minded people join hands with us, the more the society will become better.
I'm sure the effort of Aram Studios along with Flying Cockroach
Yes.
will reach your message to the public. It will increase the awareness. It will reach to people who are looking out, who are just going for amputation, and at least a one patient comes to you and gets healed. Our purpose of starting this RM Studios will
I'm
serve the
really,
purpose.
really thankful for RM Studios and Flying
Thank you.
Cockroach. Wonderful concepts you're bringing up. I've seen your previous podcasts also,
Thank you, sir.
and they are really worth watching.
Thank you.
And maybe the message, the intention with which I have, the passion which I'm having in my mind, for which I'm working towards
Absolutely.
amputation free. Now, this will give a bigger reach
Yes.
and will motivate people and bring awareness to the public.
Yes.
And a lot of great things will happen after this, I believe.
We'll put all our efforts to take it forward and keep your mission and your intention clear, sir. Thank you so much for joining.
Thank you. Thank you so much.